everybody, and welcome to this live class here at West London English School. My name is Beth, and I am an OET teacher and the Assistant Director of Studies here in Ealing in London. We're really happy here at the moment because we have our face-to-face OET classes up and running. So I've just been teaching this morning to 6 girls, nurses and doctors. So yeah, it's great that I am here with you today. I'm really looking forward to doing this lesson with you. Please let us know in the comments where you're from, your profession. We're going to do some mock practice, so any answers that you have as well, feel free to type them in there. And any questions that you have about OET or anything in general, you can ask us and someone will be there to reply to you. So let's get started. I'm going to share my screen with you. So as I said, today we are looking at listening part B. So in the exam, for all professions, it doesn't matter if you're a vet, a pharmacist, a doctor, the listening and the reading is always going to be the same for all professions. The writing and speaking is more specific. If you're a doctor, you get doctor's case notes, for example. So today we're looking at B, which is the middle part of the listening. And within that, you just have 6 questions. And the way that these questions have been designed and the text that you listen to, they are all relevant to actually how you work in your workplace and how you communicate really on a daily basis. So, for example, you might get a handover, possibly a briefing. It could be training. It could be someone giving a presentation to a group of medical students, for example, or it could just be a discussion maybe between colleagues. And the language that they are testing you on here really is listening for gist, which is to try and get the general overall idea of something. Detail, when you're listening for more specific language, maybe a specific word or phrase will help you with the answer. There is also purpose, so why is this conversation happening? And course of action, which could be, for example, preparation for future treatment. So for part B, what you get at the top of your paper are these instructions. And you will hear this on the recording. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. And then we've got those 6 questions. There are 3 multiple choice answers, A, B, and C. Now, in this live lesson today, we are going to firstly look at strategies to help you with this part of the test. And also we're going to do a mock exam. So there will be 6 questions at the end, and we will go through in detail with the answers for these. So the first strategy, we're just going to have a look at question formation. So how the content creators for OET actually make the questions for you. So here are 2 questions, and you will see at the beginning that there are 2 context statements. Now, these are really important because they tell you maybe who you're listening to, where the people are, and they just give you a general idea of context, as they're called, context statements. And then there are 2 varieties of question in a way that you get. One is a direct question here. What does the patient want to know about? And this other option is sentence completion. So here the trainee feels the cause of the problem was, and then you've got to finish the sentence. Now, you will not get all direct questions or all sentence completion. It will be a variety of both, and that is perfectly normal. There isn't one that's particularly more difficult, I would say. It doesn't really matter. It's just good for you to know that there are different options. So you have to use your time wisely. Let's look at the timing and how it works. So imagine that these are your 6 questions. You've got 2 pieces of paper with them. And what happens is you get 10 seconds to read the first question. And then they play you the listening and you answer the question. And then you're given 10 seconds for the next question and you listen and answer. And then you get 10 seconds to read and you listen and answer. So you don't, like part C, in part C, you get some time at the top, at the beginning to read through everything. You don't get that in part B. In part B, you don't have time to read through all of the questions. You have 10 seconds for each question individually. So it will always be read, answer, read, answer, read, answer, etc. So what you need to do in this time, 10 seconds isn't very long. So you need to underline keywords as you read. I'll just give you a second to read through this question. So as you're reading, if it were me, I would say you hear a senior nurse talking about a new initiative that's been introduced on her ward, okay? Problem, intended, solve. Okay. So as I'm reading through, obviously I'm not speaking out loud, but I'm reading it in my head and going, trying to get it all into my head as much as I can. So patient's confusion, information, relatives not discussing issues, patients not discussing concerns. Now, my underlining here might not be what you underline. It's more about, for you, underline the sections that are going to help you to remember it a bit more, so that when you're actually listening, you're not trying to read everything, you're just focusing on specific bits. And I've underlined it here, but you might want to circle it, do something else. And then for all of these, we've got doctor. Now, really, understanding the question or the sentence half is what is absolutely imperative in the listening. Because what they do in OET is they put in distractors. And that means that you will hear probably some kind of confusion. You'll probably hear something about relatives or family members. You might hear something about concerns and say, oh, I'm worried. But you've got to understand the question. So what problem was the new initiative on the ward intended to solve? What was the problem that they were trying to solve? So the question is important. If you only have time to get it in your head, one thing, get the question in your head. Okay, so we've got to understand all parts of the question, something else, of course, very important. So here with this question, we've got our context statement. And I should mention that you hear the context on the recording. So what happens is you will hear question 1. You hear a patient talking to a dental receptionist. So then you get 10 seconds to read it, and then the audio starts. So on the audio, on the recording, you will hear the context statement. It is read out to you, but you've not read the question or the options. Then we've got our question here, and we're going to really dig down into this question and look at it in detail for understanding all parts of the question. So here are our options. Just have a read through those. And this question, remember we said the question is really important. So this is, how does he feel? So we're thinking about the emotions. They might be conveyed through language. I mean, they probably will be conveyed through language, but also the kind of tone of voice. So if they're worried, they'll sound a little bit anxious, like, oh, but you know, I'm not sure about, and I sound a bit, oh, I'm on edge, I'm nervous. So let's have a look through these. We've got worried, disappointed, and nervous. So how does the patient feel? Now, if the patient is worried, we might hear some language, some synonyms like concerned, troubled, agitated, stressed. So the patient in this case might say, well, actually, I am a little bit concerned that I've caused some damage to the work that the dentist did. So they're probably not going to use the word worried. In the OET, for all of the listening, they don't repeat the actual sentence that you see here. So you will not hear the patient say, I'm worried that I might have damaged a filling. You're going to hear synonyms and other language around that that is similar. So with disappointed, we might hear words like let down or upset, and some synonyms for nervous like anxious, uneasy, tense, something like that. And remember, the key here is understanding all of the answer options, not just one part. So this is worried that he may have damaged a filling, disappointed that he can't be seen immediately. Now, as I said before, there are distractors. So in OET, you might hear worried that he can't be seen immediately. And in that case, neither A nor B would be the correct answer. Imagine that the patient says, oh, well, actually, I am a little bit concerned that I can't see my dentist today because I really need to see her in the next hour or so. So then the patient is definitely worried, but they're not worried that they've damaged a filling. They're worried that they can't be seen immediately. So you've got to make sure both parts of the answer options you understand properly. So as I said, watch out for distractions. And we're going to have a look at this now. I'll just give you some time to read through this question. So our question, what problem was it intended to solve? This is the question we looked at earlier. And we are only going to take answer option A. Now, I'm going to show you the transcript of the audio, and I want you to see where the distractors are. So the first thing in the option, we've got patient's confusion. We've got information given by the doctor. So we can hear primary aim of this scheme, and we know that this is related to intended to solve. So intend is the aim. We can hear queries that patients come in with. And when you hear that word queries, you might think patients. We've got information here when they've heard something contradictory. If you hear something contradictory, then you are likely to be confused. So far, everything looks like it could be option A. But the answer here, or the end of the transcript says, especially when they've heard something contradictory that needs clarifying, maybe from a family member or even the internet. So we know that answer A cannot be correct because oh, sorry, I've just realized that oh no, I am still live. Okay, sorry. Where were we? Okay, so this can't be the answer because they've heard something contradictory from a family member or the internet, and this answer option is by the doctor. So A cannot be our answer, and there you can really see those distractors coming into play. All right, and now we're going to look at focusing on the question. So what I mean by focus on the question is not focusing on the answers. So just have a read of this context statement and the question there. Now, what we're going to do is not look at the answer options. And I just want you to listen, really focus on your careful listening to answer the question, what is the trainee doing? So let's have a listen.
Hey, Doreen, can I speak to you about this patient now?
Yeah, I've got 5 minutes. You said this fella was presenting 200 over 130, right?
Yeah, so I think an ECG is essential because it will show any changes in the heart, like axis ischemia, left ventricular hypertrophy.
I think a chest x-ray is also important to see the heart and the extent of the hypertrophy. I'd also check the creatinine to see if there's any damage to the kidneys. And I think an intravenous pyelogram is needed because a renal cause is very likely.
As an initial investigation?
No, I'd say after the urea and electrolytes and after the creatinine.
But it's essential if the creatinine shows something wrong with the kidneys, yeah?
Yes, I think both creatinine and urea and electrolytes are required. In this case, they're actually more important than the ECG and the chest x-ray because the patient is young. 43, did you say?
Yeah, well, 44, yeah.
Yeah, exactly. And the hypertension is very high.
Okay, so have a think. You can type your answers into the Facebook comments. So what is the trainee doing? Ooh. Okay, so I've got the transcript here. Just have a read through it and see whether you still agree with your answer. Okay, so let's just kind of pick some of this language out and really look at it in a bit more detail. So we have Dr. 1, who is the trainee. So the trainee here is saying, I think an ECG is essential. And Dr. 2 is adding some more information of what they think is important. So I think a chest x-ray is also important. And then even adding further information. So the Dr. 2 in this case is kind of helping the trainee by adding more suggestions. So I would also check the creatinine. And I think a renal cause is very likely. So they sound quite certain, still giving their opinion. So Dr. 2 is definitely helping Dr. 1 in some kind of way. And the trainee says, as an initial investigation. So it's kind of clarifying, asking for a little bit of help or maybe advice. And the doctor says, no, I would say something else. And then once again, Dr. 1 is kind of clarifying, but it's essential if the creatinine shows something wrong with the kidneys. And when, I don't know if you noticed, but when the trainee said, yeah, it kind of goes up. So yeah, as though, can you confirm this? That's what we mean when we have that right at the end with that intonation going upwards. And then confirming, yes, I think, da, 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 da. And then in this case, they're actually more important. So it's almost kind of giving that extra information, maybe almost teaching, possibly we could say. So a good answer for this would be something like asking for an opinion, maybe brainstorming, giving suggestions, clarifying something that the trainee already knows. So now I'm going to show you the 3 answer options. Which one do you think is correct? Again, type your answer into the comments. So yeah, our answer is B, clarifying the next steps. And we saw that when we saw that language, I think asking questions. So they're just clarifying. They're like, I think I know what I'm doing, but I need just a bit more advice to help me know what to do. Okay, so next thing we're going to look at is identifying gist. Now, gist is understanding the general idea, the overall idea, and also maybe what is the main idea or the main point of the text. And there are gist questions that we get in listening part B. So we are going to do a different kind of exercise. And this time I want you to try and identify the gist. You will hear an example of how it actually is in the exam. And all you need to do here is, can you identify the gist?
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight.
Okay.
She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilization of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay, I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We will consider that at tomorrow's ward round.
Question 28. You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anaesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethidine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Okay. So hopefully you managed to identify the gist with that one. Now, in the first recording, the morning brief, the gist was really that a patient had been admitted overnight. She had schizophrenia and that she needed to stay in care until she was stabilized and she just needed monitoring. So that was the general gist, the general idea of the first one. With the second one, they were talking about this lady who is due to give birth, and she was talking about wanting or having a home birth, and she was asking about some different kinds of painkillers. She also mentioned the depression that she had after her first child. So now we're going to look at the question, because in the exam, of course, you can see the question and the options. So here is the question now. What is the plan for the patient today? And what does the patient want to know about? So again, now I'm not going to show you the answer options, but I want you to listen carefully and see if you can guess what they are. And again, just type them in the comments.
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilization of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay, I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We will consider that at tomorrow's ward round.
Question 28. You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anaesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethidine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Okay, hopefully you managed to answer those. So here are the actual questions that you would get in the exam. I'll just give you a little bit of time to read through the options and choose what you think would be the correct answer. Okay, so for A, the answer is, for 27, the answer is A. Her emotional state will be carefully observed. Now, what they say is that for today, she is to remain in high dependency unit care. They do talk about the plan for discharge tomorrow, and they also mentioned this afternoon, but remember, it's the plan for the patient today, and it was about that monitoring, so observation. Now for question 28, the answer was C, what painkillers might be available during labour. And this is because the patient specifically asked, she said, I wondered about an at-home epidural, and she also mentioned pethidine. So she was asking about the painkillers. She wasn't asking about the advisability of a home birth because she said, I'm determined to give birth at home this time. And she did mention postnatal depression, but the main purpose of the chat wasn't to talk about ways of avoiding postnatal depression. And she didn't ask about this. So even though there were distractors, the answer had to be C. Now we're going to have a look at some detailed questions. And something for detailed questions that we can really look out for and think about is synonyms. Synonyms are really important in OET in many different subtests. You need them in reading, in writing, in speaking, literally in everything. So I'll just give you a bit of time to have a read through this question. And the reason that this is a detailed question is because it is what should the nurse do first? So we need to be listening out for something like primary or to begin or straight away, immediately, some kind of synonyms that is going to help us with what should the nurse do first. So let's have a listen.
Sorry to bother you, but I need to report an incident. I've had some liquid, maybe blood, splash into my eye. I've already flushed it with normal saline.
Did this just happen now?
A few minutes ago. I was taking the drapes off after the operation and some fluid just flicked up.
Was the drape heavily soiled in blood?
No, it was fairly clean, actually.
Do you know the status of the patient? Any history of blood-borne viruses?
I'm not too sure. His notes are with him in recovery, but I can check.
You'll have to go straight downstairs to Occupational Health, where they'll advise and evaluate you and possibly take some blood.
Mm-hmm.
Then I'll help you fill in a formal risk assessment. Did anyone see the incident?
Yeah, Julie was helping me at the time.
Then we'll also need her to fill out some details.
Let's have a look at the transcripts. And here we're really looking out for synonyms. So I just want you to read through this. Can you find something about filling out documentation? Okay, I found it. Formal risk assessment. So there is some documentation. But we can see that before that it says, then I'll help you fill in a formal. So remember that the question is, what should the nurse do first? And because we've got that word then, this can't be the answer, even though there is documentation mentioned in the listening. So that can't be our answer. Let's have a look at option C, check the patient's history for possible infectious diseases. Can you see anything there about infectious diseases? Hopefully you found this bit, any history of blood-borne viruses. But what you'll notice is she does say, do you know the status of the patient? Any history of blood-borne viruses? And he replies, I'm not too sure. But the female doesn't say, you need to check immediately. In fact, she almost ignores it. She just says, oh, he says, I can check. But she's not replying saying, you know, do it now. So that can't be our answer. But where that arrow is actually our answer. So it is B, go to another area of the hospital. Have a look, see if you can find where the area of the hospital is. And it's this section here. You'll have to go straight downstairs to occupational health. So with our synonyms, we can see another area of the hospital is occupational health. And remember that question is what should the nurse do first? And we have the word straight. You'll have to go straight downstairs. So B is our answer. Now we mentioned gist, we mentioned detail, and now we're going to have a look at purpose. This time, I'm going to play you 3 different extracts. They are all related to the same subject of arrhythmia. And I want you to try and match the headings for each extract. So is it a course of action? Is it checking instructions? Is it a handover briefing? Or is it new research? And we're going to listen to each of these 3 in turn. There is an answer that you don't need.
Hi, Jen. How are you?
Good, thanks. You?
Great. How are you settling in?
Great. Enjoying it. It's just hard remembering everyone's names, but I'll be fine.
You will. One thing I needed to mention, Barbara in room 2, she has atrial fibrillation.
Yes, how is she? She was feeling dizzy last night.
The doctor visited today and he's changed her medication.
Great. She was on the flecamide, right?
The doctor mentioned it does cause nausea and tremors, hence the change.
Ah, interesting. So what's she on now?
It's all in the notes, amiodarone, I think it's called, oral, taken twice daily with food. She's taking it this evening, so no need to take it again till breakfast.
Great. Anything else to report?
Okay, hopefully you've got the right one for that. Again, you can just put it in the comments on Facebook. Let's check number 2.
Now, you do seem to have a slightly irregular heartbeat, so I'm going to send you for an ECG.
What's that?
It uses ultrasound waves to check your heart's electrical activity.
Do I have to prepare for that?
Not at all, just turn up.
Okay.
However, I am worried that your lifestyle could be putting extra pressure on your heart. You say you smoke a packet a day, is that right?
Yeah.
So I do think we need to reduce this. I can prescribe you some medication and we also have a free stop smoking service.
I really enjoy your fag at work.
I know, but it will be having an effect on your heart.
Okay. Well, I mean, I can give it a go.
Great. Now the other issue is alcohol.
Do I need to give that up too?
What do you think about reducing intake to once a week?
I guess if it'll help.
I think it will.
And extract 3.
How was last night?
Really interesting, actually. You missed a good one.
What was it on again?
It's a new imaging technique for fibrillating heart muscle.
Oh, great. How does it work?
Well, it basically lets you see the scroll waves in the cardiac tissue in high res, so you can find underlying ventricular fibrillation.
Wow. Did you see it in action?
Yeah, it's actually used with existing ultrasound equipment, which is great. So you can observe the heart in action. It's a completely new imaging technique. I think it'll be useful.
Definitely. I guess it'll help identify heart rhythm disorders much more effectively.
And it'll help develop more effective treatment methods.
And great that it's non-invasive. It's a shame I missed it.
Okay. So with extract 1, it sounded like a new nurse. They were saying, how are you settling in? They were talking a little bit about the medication. And the male nurse said that the doctor came and changed the medication. He said it's all in the notes, something about she's taken medication already this evening. So extract 1 is a handover briefing, probably in the evening, handing over from one nurse to another. Now in extract 2, they mentioned, I'm going to send you for an ECG. The nurse said, I'm worried about your lifestyle. They talked about smoking, about reducing alcohol intake. So this is kind of future plans for the patient. So it's a course of action. And then finally, they were talking about a new imaging technique. And they said, did you see it in action? This kind of stuff. So this is about new research. So you can get questions in part B, which is about identifying this purpose. So these could be your options. For example, why are the colleagues talking to each other? And the answer might be, it's a course of action for the patient to check instructions or a handover briefing, something like that. Okay, and we're going to look at some vocabulary. So normally a health professional will be using quite formal language, and the patient will be a little bit more informal. So you can improve the range of vocabulary that you know. For example, with idioms, we've got some examples here. Call it a day, or it's getting out of hand. If something is getting out of hand, it means we can't really control it anymore. These are informal. Phrasal verbs are usually also informal, but they don't have to be. So for example, something like carry on, which we know means continue. And we've got formal verbs. So while you might be more commonly used to words like check, tell, at first, try, we do have other words like verify, inform, endeavour. Instead of, I do try to take my medication, or that would be a patient, but I say you should endeavour to take your medication. So just having a general knowledge about idioms, phrasal verbs, and the formality of verbs will help you to widen your vocabulary a little bit, and will help you with this, but will also help you with reading for OET as well. Okay, we're going to have another little practice related to some synonyms. So I'm going to play this for you. I'll just give you 10 seconds to read through the question.
I'd like to go over some possible side effects of your atorvastatin medication. This is all explained in the booklet I'll give you, but I want to make sure I answer any queries you may have before you're discharged. But remember, you should contact your doctor or the ward immediately if you have any concerns.
Okay, thank you.
The less serious side effects are commonly mild muscle pain or nausea, occasionally diarrhea. The more serious include severe muscle pain, confusion or memory loss, fever, fatigue, a change in weight, dark-coloured urine, or sometimes an increase or decrease in urination, increased or loss of appetite or thirst, jaundice, and possible clay-coloured stools.
That's a lot to take in.
You won't need to remember them all, but it's important to be aware of any changes. Is there anything you'd like to ask?
No, I think I'm okay.
Okay.
I'd like to go...
All right, so we're going to look at some different synonyms and how this affects your answer and what you might hear compared to the answer options. So option A, highlight their severity. And with severity, we need to be looking out for words like serious, severe, maybe important, major, urgent. So here, for example, we can see the less serious side effects. Serious, again. We've got the word severe. So as soon as you start hearing these words, you might think, the answer is severity. But remember, they are distracting you. So it might not necessarily be the answer. Let's look at B. We've got the word understands. So they might say, I just want to make sure that everything is okay with you. They could say, is that clear? Is everything clear? Do you have any questions? And this is because they're ensuring the patient understands. So here we've got make sure, and it's important to be aware. And there's also that question, which I haven't highlighted, but there at the bottom, is there anything you'd like to ask? So maybe that's kind of also ensuring that they understand. But we've got to take into consideration the question. And again, remember the question is, why does she give a verbal explanation of the side effects? So if we look at C, we might want to look out for synonyms to do with concerns. Concern means a worry, a query, an anxiety. And we have the word queries here, concerns. And that question that I just mentioned, is there anything you'd like to ask? Now, the answer to this question is C, to allow the patient to raise any concerns. And this is because of the second sentence. This is all explained in the booklet I will give you, but I want to make sure I answer any queries you may have before you're discharged. So it means I want to answer any of your questions before you're discharged. So that's the reason, even though it's explained in the booklet, the reason she's doing it verbally is so that she can answer any questions that the patient has. Okay, so we're going to do our mock test. So you are going to get 6 questions and we're going to go through them individually to look at the feedback and look at the answers and also probably at the distractions. So question 1. Okay, you hear a patient talking to a dental receptionist. Now read the question.
Hi, I'd like an urgent appointment, please.
Let's see, who's your usual dentist?
Mr. Garcia?
You say it's urgent. Are you in pain?
Yeah, it's the tooth Mr. Garcia filled last week.
Well, he's away today, I'm afraid, but there's a free slot this afternoon with his colleague, Mrs. Brown.
Well, that'd be okay, but are you saying Mr. Garcia could fit me in tomorrow?
That's right, we'd get you in first thing. Can you wait?
Well, I'm not chewing on that side and I'm taking paracetamol, which is helping. The pain started when I was eating a steak, so I'm frightened I might have upset Mr. Garcia's work. It makes sense for him to check it out.
Okay, we'll book you in for tomorrow morning at 10.
Okay, so hopefully you have an answer for that. Here is the transcript. So the patient says in this highlighted section, "So I'm frightened I might have upset Mr. Garcia's work." So we can see worried and frightened. We know that they are synonyms. And here we've got upset his work, which we can imagine is damaged a filling. So A is our answer. So how does the patient feel? Well, he's frightened that he's upset the dentist's work. So he's worried that he has damaged a filling. We know that he did the filling last week because of that fifth line down. It says, yeah, it's the tooth Mr. Garcia filled last week. So we know that the filling was already done. Let's look at the distractors. So option B, disappointed that he can't be seen immediately. And the patient says, but are you saying Mr. Garcia could fit me in tomorrow? But remember that the question is, how does he feel? And is he disappointed that he can't be seen immediately? Well, no, he's not. Because when they say there's a free slot this afternoon with his colleague, Mrs. Brown, the patient says that would be okay. So he's not disappointed. And if we look at nervous about being treated by a different dentist, again, it's the same thing. So he's away today, I'm afraid, but there's a free slot with his colleague, Mrs. Brown. And he doesn't say that he's nervous. He says, that would be okay. Now, the distractor here is when it says, I'm frightened I might have upset Mr. Garcia's work. It sounds like maybe he's nervous, but this is not our answer. Let's do question number 2. Sorry. You hear part of a presentation to nursing staff about an extension to visiting hours. Now read the question.
Now, you'll have received the survey asking your opinion about extending visiting hours, and doubtless you've got your own ideas about the possible impact on your work. You're probably aware of the evidence pointing to the positive effects on patient recovery rates of increased contact with loved ones. This isn't in question, but of course things must be managed properly. I've heard concerns about how busy everyone is, that you've got enough on your plate without having to worry about extra demands from visitors. Well, we've carefully planned things to prevent you being overrun with queries, interruptions, and so on. Visitors will be given a list of do's and don'ts outlining what's expected of them. Meanwhile, managers will be monitoring things carefully to make sure routines aren't disrupted at all.
Okay, so if we take option A, detailing the benefits of the plan change. Now, this line, you're probably aware of the evidence pointing to the positive effects. Now, we do see the word positive. Positive effects sounds like benefits. But the question is detailing the benefits. And what they say is, you're probably aware of the evidence. So if the nursing staff are already aware of the evidence of the benefits, then the speaker doesn't need to detail them. So A can't be our answer. Now, if we take B, reassuring them that their workload won't increase, we can see some nice language here for reassuring. I've heard concerns, and without having to worry about extra demands. And we've also got this next line, we've carefully planned things to prevent you being overrun with queries, etc. So again, this is reassuring. We've carefully planned things. And remember, you have to make sure that you focused on both parts of the question. So reassuring them that their workload won't increase. And here it says that idiomatic phrase, you've got enough on your plates without extra demands from visitors. Now, if you've got enough on your plates, it means you've already got a lot to do, so you don't need extra demands. We've also got the word busy. I've heard concerns about how busy everyone is, so we know that they already have a high workload. So B is our answer because of everything already mentioned here. Let's look at question 3. You hear a surgeon discussing a patient with a nurse in the recovery ward. What is the surgeon? Oh, you don't get the question.
It looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Will she be going up to the ward soon?
Yes, I'm going to call a porter. She should be going up in 15 minutes.
Okay. I've added some extra post-op pathology orders. She may have problems with the drop in her calcium. Her thyroid was just huge. We didn't see all 4 parathyroid glands, and we need to check that they haven't been affected by the procedure. She seems okay, but I want her calcium level checked twice a day. She needs to be monitored for any breathing problems, muscle cramping and numbness, and for tingling in her fingers.
Okay, I'll make sure a report to watch out for hypocalcemia is passed on.
Okay, if you need me, call me.
Okay. So here the question, what is the surgeon concerned about, so worried about or anxious about? And our first line here was Mrs. Jones is still a bit groggy after her thyroidectomy. Now, groggy is a word that means when you're not quite asleep, but not quite awake. So imagine that you have just had an operation and everything is kind of wearing off. You're slowly waking up. And the feeling that you have as you're waking up, you're not quite all there, you're feeling a bit groggy. Okay, so that's the meaning of that word there. And we've got after her thyroidectomy, so we know that this is to do with post-operative. After and post are synonyms, and thyroidectomy is a type of operation. And everything that the surgeon says is related to side effects. As he says, we didn't see all parathyroid glands. He talks about the calcium level that needs checking. She needs to be monitored for breathing problems, muscle cramping and numbness. So this is what he is worried about, is her side effects because of the operation, because of the thyroidectomy. Now we're going to look at questions 4, 5, and 6 all together. We will go through each of them after we've done them. So you hear a chiropractor briefing a colleague about a patient called Ryan. Now read the question.
Today we're going to start with Ryan. He's 2 weeks post-surgery for a torn rotator cuff. He also had a spur on his acromion process removed. This is his first time in rehab post-surgery, I believe.
That's correct.
Okay, so today we're going to begin utilizing high-frequency vibration to break up the scar tissue forming in his left shoulder joint following the surgery. We're going to do each of his treatments that way, so you'll see a progression over time. how we get him back to a point where he's able to live his normal life. Movement's the key to rehabilitation, and this treatment resonates with the nerves too, so it should eventually help them heal quicker and reduce his discomfort.
Question 5. You hear a surgeon talking to a group of medical students about patient risk in emergency surgery. Now read the question.
If you look at the risks of elective surgery, they're really very low compared to emergencies. Clearly, then, we can make the biggest difference in reducing risk and improving outcomes in emergency surgery. Our mortality outcomes here are actually below average. We're at 8% compared to around 13% nationally. The emergency patients I handle tend to be older, so they're at higher risk. And when they come in, we haven't got long to prepare them in order to reduce any risks, maybe an hour or two. In terms of patient safety, every minute, every half hour we can use to get them ready counts. That's because the patients we're thinking about are prone to developing post-operative complications, given that they have a range of associated heart, kidney, and lung problems.
Question 6. You hear a surgeon talking to a patient who's just had a knee operation. Now read the question.
How are you feeling, Mr. Shaw?
Oh, exhausted. But the painkillers must be working. I can't feel my knee as you predicted.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Oh, thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month.
Good.
Give it 4 months before you put any serious impact on it, though.
4 months? After my last stop, I started running again within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
Yeah, if your body's hurting, it's telling you something.
Okay.
All right, let's go through the answers here. So with our first one, it was a chiropractor talking to a colleague about a patient. Our question was the overall aim, so we're listening for gist here. And what the chiropractor said was, we're going to begin utilizing high frequency vibration to break up the scar tissue forming in his left shoulder joint following the surgery. Now, this area is key for the answer, because if you have scar tissue forming following surgery, this is a side effect of an operation. And as the chiropractor goes through after surgery, we're going to do each of his treatments that way. And he keeps talking about movement is the key to rehabilitation. So everything there, including this treatment resonates with the nerves too, so it should eventually help them heal quicker. Everything here and his overall aim then is treating the side effects of an operation. So C is our answer here. Now, if we look at the other options, we've got improving pain relief, but actually there's nothing here about pain relief apart from at the end where they're saying reduce his discomfort, but that's not the overall aim of the plan. And restoring feelings in his arm, it does talk about, where is it? Movement is the key. It resonates with the nerves too, but it's not talking specifically again about the overall aim being the feelings in his arm. It's about breaking up that scar tissue and doing that treatment so that eventually he will be healed. Let's look at 5. So we had a surgeon talking to medical students, so some trainees. And the surgeon is emphasizing what? So is he emphasizing minimizing patient risk, more risk for patients at high risk? And we can see here that because in A, B, and C, we've got the word risk, that is going to be a key component to what we're listening to. So actually the most important part of each option is the other side. So prompt preparation, so preparing quickly, the different types of surgery, or the recovery time. So even though risk is there, it's everything else in the question, in the answer option, that is more important. Let's look at this middle section of the transcript. The emergency patients I handle tend to be older, so they're at higher risk. Oh, sorry. We haven't got long to prepare them in order to reduce any risks. So we've already got 2 mentions of risk there. Maybe an hour or 2. In terms of patient safety, every minute, every half hour we can use to get them ready counts. Now, from everything that's there, it sounds as though they're talking about prompt preparation. Prompt means quick, so preparing quickly. That line that we've just read, every minute counts. We haven't got long to prepare them to reduce any risks. Now, minimize and reduce are synonyms, so it's clear that they are connected in some way. And so A is our answer. Let's look at 6. So we have a surgeon talking to a patient, and the man's comments, so the patient's comments, reveal what? And just like that question we had earlier about feeling, here we've got how he's feeling. Is he determined? Is he impressed? Is he surprised? And we've got to take into account the other half of the answer option. So determined to do sport quickly, impressed by the little time he spent in hospital, or surprised that he'll be pain-free. Now here I've got colours to show you where the answers are or where the distractors are. Let's start with A, determined to start doing sport as quickly as possible. And the last bit, it says, after my last op, I started running again within a month. So this sounds like, aha, he wants to start doing sports and running, and within a month, quickly. But then we have that next sentence. Thinking about it though, I guess I paid for it. Now, if you pay for something, it means that there were disadvantages. So possibly he started running again within the month, but then his knee started hurting. So this is what we mean by he paid for it. There were no advantages to it. If we look at B, impressed by how little time he spent in the hospital. And we've got this line, the idea that it gets done in less than a day. So less than a day is the little time in hospital. Is pretty mind-boggling. And the meaning of mind-boggling is impressed. Now, mind-boggling means surprised or amazed. And if we kind of combine them, it's almost surprised that something is so amazing, which is similar to impressed. So they are synonyms. So it sounds like B is our answer. Let's just check C. Surprised that he'll be relatively pain-free so soon. So he says the painkillers must be working, so painkillers and pain-free. And I can't feel my knee. But then he says, as you predicted. So he is going to be relatively pain-free, or he is pain-free now, but he says, as you predicted. So he is not surprised. So our answer has to be B. He's impressed because it is mind-boggling. Now, I want us to have a quick look at some of the vocabulary that we had in that part B, because some of it was a little bit difficult. I'm just going to give you a minute or so to see if you can remember any of the vocabulary from 2 to 7. There are some hints on the side of your screen, and when you think you've got the answer, you can type it in the comments into Facebook. So I'll give you about a minute for this. Okay, so what do we think for number 2? So the pain started when I was eating a steak, so I'm frightened I might have upset Mr. Garcia's work. So frightened and anxious are synonyms. Number 3, hopefully you remember this. I've heard concerns about how busy everyone is, that you've got enough on your plates. Number 4, it looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Okay, so today we're going to begin utilizing high frequency vibration to break up the scar tissue forming in his left shoulder. So forming is being made. Utilizing is one of those formal verbs for use. Number 6, prompt preparation means quick preparation. If we say the adverb as well as promptly, so can you do something promptly means can you do something quickly. And finally, number 7, the idea that it gets done in less than a day is still pretty mind-boggling though. So remember, mind-boggling is like amazing, surprising, impressive. So if we really think about part B, listening, you've got to read or listen carefully to that context statement because it gives you an idea about who you're listening to and also where you are or where they are. Underline words in the options. Underline as much as you can to help it get into your head and so that you can concentrate more on listening rather than reading when it actually comes to the questions. Remember how important the question is. Because they put distractors in, you must remember that you're always answering the question. Don't lose sight of it. Listen to the whole audio because of detailed questions and just in general, there could be something right at the end that gives you the answer or something at the end that makes you think, actually, maybe it's not what I thought it was. So don't stop listening. Keep listening for as long as you can. And listen to both speakers. Even if it says, what is the man doing? Listen to both of them because they will always support each other in a conversation. So you'll be able to get the answers from both of them. Be aware of synonyms. We say this constantly because synonyms are so important in the exam. But as we've looked through today with the audio, with the questions, with the transcript, there is so much synonymous language. And what you can do is use a thesaurus, use your phones. When you're preparing for the OET, really make sure that you dedicate some time to synonyms. Again, don't stop listening. So we just said, listen to the whole audio, but the same thing, don't stop listening. Don't think, I've got the answer and turn off because it's not going to help you. So that is our lesson for today. I just want to tell you a little bit about the courses that we run here at West London English School. Now, as I said, we do have our face-to-face courses at the moment. So if you're in London, come in and talk to us. But if you're not here in the UK or in London, you can do any of our online packages. So we have listening packages, which have lessons on A, B, and C with lots of practice tests, and you will get detailed feedback on all of those answers. We have writing packages as well with video lessons, language lessons to help improve your grammar and your vocabulary, and also 5 tests that you will send to us, and Harmy, who is our OET course director, or myself will mark them and give them back to you with feedback. We also have a writing correction service, so if you don't want to have the lessons, you can just pay. It's a really popular option. Just pay for a letter, write your letter, we'll mark it and send it back to you with feedback. All the feedback that we do for writing includes the writing marking criteria. So you'll really know where you are and how you're doing, where you can improve in terms of your level. We also have speaking packages, which are video lessons and role plays. So you will actually work face-to-face live with video with a teacher, probably with either Harmy or myself or Catalin, who is also an OET teacher. And you'll work with us as we do some speaking practice and you'll get all your feedback. We also have a reading package, again with video lessons to help you with parts A, B, and C and some practice tests. And if you want the full package, if you want all of the subtests plus the language lessons, writing feedback, speaking practice, you can choose our silver, gold or platinum package. So the platinum package, a lot of people go for because it has everything that you need there. It is really detailed with a lot of practice, but the silver and gold also have lots of feedback, but just a bit less of the actual tasks to do. This is us, this is the team. So our OET course director, a lot of you already know him, is Harmy Baines, who is there. And we also have Catalin, who is an OET speaking interlocutor. So if you're lucky enough to do some speaking with Catalin, you'll be thrilled. She's fantastic. So thank you for watching. I hope that you found this lesson okay. Do give us any feedback that you have. I think that Harmy is going to be doing a live lesson with you next week, and I will be back in 2 weeks' time. So thank you. Take care. Oh, sorry, that's our classroom making a loud noise. Do stay safe, and yeah, we will see you in a couple of weeks. Thank you. Bye.